Thank you for inviting me, and thank you for inviting all of the candidates up here. A little bit about me. My name is Fred Carl. That's two first names. And that's for Doug's benefit. I am running for the State Senate in the Senate District 47, which is the University area, South Hills, and Patty Canyon. A little bit about me. I grew up in Buffalo, New York. My wife and I moved here to Missoula when we had 3 children, a 6-year-old, a 5-year-old, a 3-year-old. Why she stuck with me, I don't know, because we got here with no job and $157. I went back to school. I've worked in lumber mills, I've tended bar, I've washed windows, I've done all kinds of things. I can sit here and tell you anything you want to know and make you feel good, but you didn't get where you are without being realistic. Let's look at the situation. We are all compassionate. My father died, I was 14, I was the oldest of 4. My mother had Alzheimer's, died. My wife died of Alzheimer's, she had 9 years of it, and then my daughter, a month later, we took her to Dr. Bach, Dr. Paul Bach, here in Missoula, psychiatrist, and that said she was faking. It took everything I had, and she now has maybe 2 years to live. We all feel compassion. We all want to do what's right. But let's look at the situation. We will do what we can, as far as I'm concerned, when we're in Helena. The income to the state of Montana, 43% comes from the federal government. We have 3 out of the 27 or 30 departments that take 91% of that. Our income is going to be drastically reduced. We have to look at things the way they are. We will try and do whatever we can and be as compassionate as we can, but we have to be realistic and look at things and look at the overall situation.
Thank you.
I will do that. Thank you.
Now we'll move on to our issues as they have been outlined by the Disability and Aging Alliance. We'll get through as many of these as time will allow. The first one is on provider rate increases. The Department of Health and Human Services contracts with private businesses and organizations for services. These services include personal assistance, home and community-based services, aging services, developmental disability services, mental health services, and others for people with disabilities and older adults. The businesses and organizations are currently being paid at about the same rate that they were paid in fiscal 2009. On July 1st, 2011, rates were cut, returning many of the programs to their July 1st, 2008 funding levels. There had been an increase, a proposed increase at that time, and it was rejected. The proposal here is to increase the provider rates to agencies who support the state citizens to account for inflationary and labor increases to assure that they can continue the current level of quality of support to these individuals. The proposal is not intended to provide additional services to people being served or to serve additional people. It's simply for the increased cost of providing the same services. So the question is, when looking at House Bill 2, which is the budget bill, if you succeed in your bid to gain a seat in the Montana State Legislature, are you willing to increase the budget for providers in aging and disability services? If so, please tell us how you would make that happen and what sort of priority it would take in your legislative agenda. And we'll go back down the line starting with Mr. Cole.
As I said a few minutes ago, we in the legislature will have a very, very difficult time. With less money, less people working, less money coming from the government, less money coming from taxes, by people working. We want to create the best that there is possible. And all I can say is we have to be realistic. Sometimes people say, no, I don't want to be realistic, I want all this. And you can't have it. We can't be like children at Christmas time and asking for all the gifts and expecting to get them. I feel that I am very compassionate. I know I am very compassionate. I know that I want to help people. I have helped people. And you people, all of us, have to realize where we are and help everybody else. When I grew up during the Depression, people helped each other. Families helped each other, neighbors helped each other, and the church. We didn't have any welfare program. People were willing to help. And we are going to have to get back to where we are willing to help our neighbors, our friends, and our relatives. And from that point of view, I feel that the state can do only what is available, and it isn't going to be very much, I'm sorry to say. Thank you.
Well, I'll follow up on one note that Fred struck. So we hear a Democrat and a Republican agreeing on something here, and that is we do need to regain a sense of community. I take a somewhat different approach than Fred does and some other of my Republican friends, and that is that I think we have enough money. We have a $400 million surplus in Helena. Montana has some of the lowest taxes in the nation, and the United States has one of the lowest tax rates, in fact, the lowest tax rate of all developing nations. There is enough money available for the three basic things that government does. And it is for me, healthcare is a priority, and healthcare includes disability and aging services. Education is a priority, and that includes providing education for students with disabilities. And public safety is also a high priority. We have the money there. We hear people talk about grain in the bin. Well, that grain doesn't belong to the people in Helena. It belongs to us. And I think that we can set enough priorities. There's enough money there so we can increase from a 2009 to a 2011 or 2012 level healthcare and education. So the money's there, we should use it.
One thing to follow up from what was just said, that $400 million, that's a projected surplus, not an actual surplus. So this is like spending money that we don't have right now. Unfortunately, there's a lot of things in 2013 that are going to change. A lot of new taxes are going to come into play. The IRS right now is talking about medical equipment taxes, which is going to drive healthcare costs even higher. Some of the things that we can do to combat that in the state is look at eliminating the business equipment tax, which will eliminate taxes on business equipment for clinics and hospitals that use high-end diagnostics and high-end medical equipment used in many medical procedures such as heart bypass surgeries and whatever you can think of. We do have to prioritize funding, and I believe that aging and disability services should be just as high as a priority as education, but we do have to balance these things. We also have to make sure we maintain roads, streets, highways, but we also need to make sure we have some type of an emergency set up. Because if we don't have an emergency fund set up, we can get bit when a natural disaster occurs. We already had one that occurred back in the 80s when Mount St. Helens blew up. We didn't see that one coming, didn't plan for it. And even though something like that happening is remote, we also have wildfires. We can have a horrendous winter season with avalanches and whatnot. So we need to have extra funds available so we can keep roads, streets, highways open. And how does that affect people that are retired? That affects all the supplies that are coming into the city. Missoula doesn't manufacture much. It doesn't manufacture a lot of pharmaceuticals, it doesn't manufacture medical equipment, it doesn't manufacture vaccines that we need. These all come from out of state. We need to keep the roads open. And one of the unfortunate things that I saw during this last winter season was our plow truck drivers threatened to strike because they haven't gotten a raise in 3 years. Well, we can't afford to have them go on strike because we can actually get snowed in Missoula, which means fewer supplies are coming in for medical services, food, that everybody relies on. So we do have to prioritize, and I believe taking care of our seniors, disability, and education should remain a high priority, but we can go as far as we can, but we can't break the bank.
I do support increasing provider rates, and I have supported increasing provider rates in the past in the legislature. If you want to see the hero of provider rates, he's standing there in the back of the room, Representative Tim Fury, who worked tirelessly. To try and get provider rates increased. And at the risk of being excessively partisan here, I'm going to say that the only way you're going to get the only way you're going to get provider rates increased is if you have bipartisan support for them. Because provider rates, Tim tried to amend House Bill 2 to get the provider rates increased. And it didn't happen, and if you go back and look at the party line vote, it was a party line vote. So unless you have Republicans signing on and being willing to support higher provider rates, it ain't gonna happen. The Democrats, unless we're in a majority, cannot make it happen. It's gonna have to be a bipartisan effort. And you're going to have Republican support, and if you don't have it, we simply can't get there. Ask Tim, he can tell you he's tried and tried and tried. The money is there, I have no doubt about that. And this projected budget surplus, most of that money is already there. There's no question about that. And there's going to be more surplus in the future. I don't think there's any question about that. There's only one thing I want to say about this notion that we haven't increased them since 2009. That's true. But the other thing is they were lamentably, horribly low in 2009 to start with.
Yes, I would also support increasing the budget for service providers. We have talked about the budget surplus, and it is projected to be over $4 million, but it is currently at $268 million. So we already have a budget surplus that should be given to some of these services. I'm running for House District 99 because I was so disappointed at our legislation this last session. There was gridlock, there was fighting, it was embarrassing to be from Montana to hear what was going on. There were services cut because of faulty budget projections. And now we're seeing that, as Doug said, we have it in our coffers, but we need to spend it for Montanans. If we want to look at getting additional funding, we should look at eliminating the tax breaks for the wealthiest 2% of Americans who don't really need them. We should look at doing other things besides cutting services to those who depend upon those services for their livelihood, to eat, to have somewhere to live, to be able to get around. Those are the services that our government needs to be providing, and those are the services that we have the money to provide and that we need to ensure are occurring.